Restorative scans. When the patient has integrated implants and a temporary denture on the lower arch. First, we need to perform foundation scans. Using the relevant scanning window, scan the upper dentition. Follow the scan strategy indicated by the intraoral scanner software. When scanning a denture, we must ensure a stable bite. To do this correctly, we first scan the facial and occlusal of the denture extraorally. This is to provide the scanner with a reference to form the bite scan. We will return to complete the rest of this scan shortly. Before scanning the bite, we need to stabilize the denture. Add impression material to the denture to form a wash impression. Be careful not to add too much as this will affect the vertical dimension. Carefully place the denture in the patient's mouth. Make sure it is correctly seated and that the patient forms the correct, stable bite. Any movement will result in inaccurate scan data. Some scanners require a single scan across the entire facial surface. Others require 2 separate scans. It is advised that even for scanners requiring left and right scans, to scan up to the midline, not just the occlusal contacts. Once the bite scan is complete, carefully remove the denture. Ensure the wash impression is set. Return to the original scanning window in your iOS software and continue to scan the denture. Begin on the facial or occlusal surface to provide the scanner with a recognizable feature, and then continue to the tissue side to perform a detailed scan of the impression to form a 360-degree scan. With the lower denture scanned 360 degrees, the upper arch, and the bite scan complete, it is time to perform the scan gauge scans. To accurately capture implant data, the scan gauges must be arranged correctly. Gauges must be in close proximity to each other without touching. They must be completely seated and, importantly, always use retractors to avoid interference. Use any combination of gauges necessary to bridge the gaps or relieve tissue pressure. If 2 multi-units are too close together for 2 scan gauges to fit, replace one with a narrow scan body. Turn off any AI or scan assist feature on your intraoral scanner. Once checked, begin the left to right scan. Start at the most distal implant on one side, rocking the scanner head over the top of the gauges and moving across the arch in one continuous motion. Do not go back over previously scanned areas. If errors or artifacts appear, delete the scan and start again. Once complete, save and open the next scanning window. Repeat the scan from right to left. Tilt the scanner as necessary to capture all facets. Before removing scan gauges, export both scans as STL or PLY files and check in the Nexus analyzer. The single arch restorative protocol using dentures requires a total of 5 scans, as well as the standard 2 patient photos. Following the correct procedure of scanning the dentures and capturing the impression data is important. For more information, see the Clinical Resources section on the Nexus Connect Lab website.